Next, as you're doing the inspection of your feet on a daily basis, you may be asking yourself, what sorts of changes do I need to address myself? What sort of changes do I need to call my doctor about? Those type of changes occur on a scaled basis, and so if you're inspecting these things daily, hopefully they won't get to the point where you need to call your doctor. But if they do, the things you want to look for are breaks in the skin. That's the main thing to call the doctor about. Anytime you have a break in the skin, it's a potential source for infection. You want to cover these areas and keep them clean. You want to wash them with dilute soap and water, and then cover them with an antibiotic ointment, over-the-counter antibiotic ointment, and a Band-Aid or appropriate bandage. If you are at all concerned about handling this in this fashion, by all means you should call your doctor. It's much more important to use caution than to think something is less than it actually is. Again, as I mentioned before, having diabetes suppresses your immune system, and so oftentimes things get overlooked because your own body does not mount the same response to infection or problems that someone without diabetes has. And so it's important to address these things very early by keeping them clean is the primary thing, and then addressing them, inspect them on a daily basis. If you see the redness getting worse from one day to the next or even hours to the next, that also should prompt you to call your doctor and follow up. Next, if you have redness or a breakdown in the skin, and you start to feel sick, if your blood sugars are higher than normal, if you have flu-like symptoms, nausea, vomiting, sometimes these are the first sign that you actually have an infection in your foot, even though the wound on the foot may actually not look that bad to you. It may just have a small amount of redness and a small open sore. It doesn't have to be a big open draining wound for you to prompt a call to your doctor. These systemic symptoms, these general symptoms you have throughout your body are often the first indication some people have there's actually a problem going on.